are 1,
2,
3,
4, 5 women. We all share the same smile. Oh my goodness.
Láàárín gbogbo wa, à ń sọ èdè mọ́kànlá.
tuhingira omaraka murongo na imwe. We speak 11 languages.
We have 19 piercings.
We played in the stream as children.
And we all loved to sing.
Okay.
Okay.
Right, back to business. What was the line again?
We had professional occupations and careers back home.
Accountant,
Electrical engineer,
preschool teacher.
managing 600 men in a power plant.
As asylum seekers, collectively, we haven't been able to work here for 13 years.
What a waste.
100% of us have suffered extremely poor mental health. Suicide has been a risk for most of us.
We are all mothers.
We've had 12 children.
4 were born here while seeking asylum. 3 we had to leave back home.
One of our babies died in the asylum system.
We arrived here fit and healthy.
But as asylum seekers, we and our babies are more likely to die.
Despite our struggles, we
are survivors.
Why did I seek asylum? A tough question.
The cases are different. Your reason is not my reason.
Might be for political reasons or for personal reasons or for any other reasons that made that person to flee from their country.
Violence, child abuse, FGM,
female genital mutilation.
Because of war, you have been threatened.
And you feel there is nowhere that is safe for you in your own country.
Why should I start with someone else? I should start with myself. So, someone who's leaving their home to a place where they feel safe. And of course, they'll be heard. And I think it's just that. Where you'll be heard and you'll be allowed to live in peace. You don't think about benefits. You don't think about job. You don't think about even family because you're just running with whatever you have. Leaving everything you've worked for all your life. I couldn't bring my children with me. I couldn't bring them with me. Not knowing even, like, am I going to make it back for them to come and get them? Like, you know, it feels like failing.
I do miss home.
Home is where I've grown up. All my life memories are there. My loved ones, everybody is there. Home was beautiful. Our house was really nice. I had a good job. We did everything possible good. And then suddenly everything just burst in a minute that I felt I was no one. I was running in the car with my children, trying to protect them.
No, I have nothing there to go back for.
Sometimes you don't have a choice. You're on your own.
a place to start all over again.
I just wanted to be safe.
The question is, where do I go from here? There was no house, there was no roof over my head. I didn't know anybody here. I couldn't do anything, I couldn't even work. And that was when I was told that I could contact the Home Office, then to seek asylum. Can I tell you about accommodation for asylum seekers? Oh my God.
It was 3 of us in the same room. You share the room, you share everything. We don't have somewhere to cook. And just 1 meal a day.
You live off a kettle. Pot noodles, rice, bread, sometimes pasta. A pregnant woman is not getting the nutrition that she needs.
Without a kitchen, it's difficult to make your baby's bottles and even your toddler's meals.
I can't even speak to someone because I don't know you. I don't know who is beside me.
You're never certain of where you're going to or when you're going to be moved. You just get a letter from the Home Office saying that you're going to be moved to another accommodation. I was moved to a shared house, shared accommodation.
With 1 bathroom, 1 toilet, 1 kitchen, 1 cooker, 1 microwave, everything one inside there.
You see that their houses are leaking.
Some as well have like rats in the house.
I had to take the storeroom because I was the last person to come into the accommodation, where there was a single bunk bed in it. I could barely fit into the room. It could contain just myself and my sneakers. It was zero hygiene, sharing the same toilet and bathroom. There's no place to even wash because the sinks are all blocked. The whole place is filthy, dirty, and unlivable. Some drug addicts, people, men all the time walking in and out, banging the door. It's never closed. It's always open.
Anybody comes in and out. You don't have any control of it.
You can't even have peace in the house. I can't even sleep. And when the men are coming, they will be knocking my window. I can't go to the bathroom. I can't go to the kitchen because of that. So I have to have a bucket inside where I wee, I poo. Then after I have to take it upstairs when there is no one inside the bathroom. It was a hell for me. A hell. I go through hell in that house.
That was where I was pregnant in. It wouldn't be okay bringing in a newborn into the accommodation. Hell no, no.
How am I going to raise up my child in that home? You will not even bring out your child to get fresh air. And you want to go prepare food for your baby to eat. And the people you are living with will be taken from your food. And if it's that only meal you have for the day, you will go hungry.
So as an asylum seeker, these are some of the barriers you face.
The barriers are endless. The color of your skin is a barrier. Your name is a barrier. The way you speak is a barrier.
Language is a barrier. Not being able to read and write is a barrier. Not being able to communicate with other people is a barrier. Seeing yourself as how the community perceives asylum seekers is a barrier.
Not knowing what to do as a pregnant woman and what to ask for is a big barrier.
There are asylum-seeking women that do not even know where to go to, even to book the first appointments.
Where do I need to go? So directions are a problem.
You're an asylum seeker. They said you have to go to a hospital. The fear in you to go to that hospital. English is not my first language. If I go to the hospital, I ask for an interpreter, but it's not my language. The language barrier will make you don't want to talk. You get scared to say anything.
So one of the biggest challenges is proper information and someone to point you to the right direction. How do I get the information? Who do I turn to? And even when I get the information, what do I do with it? You literally don't even know what to do. I didn't even know I had access to the healthcare.
Then, if they give you a prescription, if you don't know that you don't have to pay, then you go to the pharmacy.
I was asked to pay, even as an asylum seeker. But it was a medication that was covered under the HC2 certificate. And this was when I was pregnant, actually. And I told the person, I had to lower my voice and I am an asylum seeker. I didn't want to shout because people were around me. Some people might turn around and then never return because of the stigma. Then all of a sudden you get a letter that you're being moved to some other place.
So that means that you have to go through the whole process of getting the GP, getting yourself sorted out.
We only get our appointments by post. But the week the Home Office moved me, I missed an appointment with my midwife. She had to call me on the phone and said, "You missed last week's appointment." She said they sent a letter to me. So that's when I realized that it must have been posted to my former address. Imagine if my midwife wasn't kind enough to tell me I missed an appointment.
Transportation is a barrier again. If you want to access anything, going for appointment, going for drop-in, because of the money.
Which one is more important? Should I just forget about the appointment and eat?
It's what you need first before what you want.
You have food, you have medicine, you have transportation. You have to take one.
Can I ask a question? What do you buy with the £3? What can a £3 get you?
When you go to the hospital, they will tell you that you have to be eating veg, you have to be eating green leaves.
Because I was anemic, I was given a list of food to eat. I mean, I couldn't really afford all of them. There was no difference between when I wasn't pregnant and when I was pregnant. There was no luxury to change diet. Nothing changes.
I don't know who created the Home Office. But man, that place, even mentioning it or saying it, the Home Office, you just get that boom, 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 dramatic music behind. Literally, they've got every life decision in their palm of the hand. So you just kind of like train yourself not to expect anything, because anything can happen.
It's terrifying getting a letter from the Home Office.
When you see that envelope, the brown envelope,
Even to pick the letter from the floor.
Should I open it? Should I not? Should I look at it? Should I not? Should I just dismiss it and then ask a friend to open it for me? It's a piece of paper, but it carries a whole lot of weight.
what if? Your life is filled with what ifs. You are being faced with them telling you to go back to what you are running from.
They still have the last say.
That's when I got scared. I hated to open the door because I thought someone would come to pick me up and take me away.
You know, instead of you going back there, you rather die. It puts you in a place of absolute fear.
So it's like a dark tunnel, a dark place.
You start locking yourself up. And when you start locking yourself up, you don't realize how much you've locked yourself up. Everyone you see around you is watching you. You're locked and you can't get out of it. I went into this thing that, I could not get out of my bed. I would hide inside the duvet cover. You forget you have to eat, you have to wash yourself, you have to change your clothes. Am I still talented? Will I ever be able to work? You don't believe you can make a difference in community. You forget all the talents that you have.
Don't have any sense that I'm in this world. When you don't have anyone to talk to, anyone to cry to, and find comfort, you don't have it. It's not there.
Mentally, you're drained. Physically, you're drained. You can't move forward. You can't move backward. Sometimes you feel like ending it all.
That is isolation.
Nothing at all. Just pitch black.
Can I use the word drowning?
It feels like you're drowning in a process. It's like you're just underwater, taking the life out of you, squeeze your life out of you, going through your ears, your eyes, your mouth. You just give up on hope. You can't save yourself because you don't have the skills to.
With no help from anywhere. I am drowning. There is no hope. But I have to believe there is hope somewhere. My midwife, one word, exceptional. Always very ready to listen to you. She always goes, "How was your day?" And when you go, "Fine," she goes, okay, that's not good enough. Just say it, I'm listening. She fought for me. Even my experience with the whole pharmacies thing, when I said I went to the pharmacy and was asked to pay, I came back to her and I was like, this is what the pharmacist said. And she said, 1 minute. She started typing into her system and said, go back there. When I went back to the pharmacist, I got the medication. She was just a very wonderful person. Giving birth alone, there was nobody in the hospital with me. It was just too dark for comfort. I was alone, lonely, nobody was with me, it was just me. When I got back home with my son, he cried throughout the night. He cried and cried and cried, and I started questioning my actions. I felt I had a lot of emotions running through my head. And I remembered reading about sudden infant death. The emotions were out of this world. I can't describe it. It was bad. My midwife called me on the phone and said, "Are you home now?" I said, "Yes." It was evening. I think it was even out of work hours. But she showed up. As soon as I saw her, all the tears I've held back for like 3 days started rolling down my eyes. I was crying. And she said to me, "Leave the baby in the parlor. Come into the room with me." I would never forget that day. She sat down on the bed with me, at the edge of the bed. She held my 2 hands and she said to me, "I have a child who's 21 years old now. You are not the first. You will not be the last. I went through it, you will go through it, and you will survive." And she asked me, "What are the things you need right now so I can do it for you?" She was the best.
Keep on doing what you are doing, the good job you are doing. Because some midwife can step into the mother's shoes. Some of us, we just need someone to talk to. A friendly conversation can go a long way.
Hello, I'm Sama. My name means sky. I was pregnant when I arrived in this country. I have a booking appointment with a midwife, and I find out I'm 10 weeks pregnant. She asks me lots of questions. She is nice and she listens to me, and she gives me an appointment at the hospital for a scan and blood tests. It is the first time I feel supported here. The scan is okay. I can see my baby's heartbeat. I miss my mom and my family back home. I am waiting for my appointment letter to see my midwife at 16 weeks, but instead, Serco tell me I'm going to be moved. I don't know when or where I will go. This is the hotel room they have put me in. I share it with another woman. It's not easy. I've missed my appointment letter and the letter telling me if my iron is low, as well as the HC2 certificate to cover the cost for prescriptions. I need to find a GP. I've spent the first 2 days crying, but I must be strong for me and my baby. I'm now registered with a new GP surgery, and the midwife confirms I am 17 weeks pregnant, and she tells me to get iron and vitamins. I find a local pharmacy, but they tell me I must pay. I quietly explain that I am an asylum seeker, and they ask me for the HC2 certificate. I feel so embarrassed. I try to explain my situation. I have a Section 98 with no money to pay for the prescriptions.
I'm sorry, you have to pay.
They think I'm trying to steal. I want to disappear. I am scared of doing something wrong because of the home office. I am so tired and it's getting harder to walk street after street. Later, I find out that you don't need to pay for prescription when you are pregnant. I can feel the fluttering feeling of my baby, but at 20 weeks, I am still waiting for the appointment. Time is passing, and my belly is getting bigger. It is 24 weeks, and I am feeling worried and tired. I still haven't had my appointment, so I have decided to go to the hospital. After a fast-track booking history and scan, the midwife takes my blood again. I have to come back for a 26 weeks appointment, and I ask for an interpreter.
Oh, hi. Thank you. Okay, you have an appointment to see the midwife. If you just wait 1 second. Hi, Sally, there's a lady here for you. Thank you, thank you. Midwife will be with you in 1 second. Thank you.
At the appointment, the midwife explains there isn't an interpreter booked. Language line is not working for some reason either. I am told to come back next week. I feel invisible. I've come back, now 27 weeks pregnant, and I am given a prescription for low iron. I am told to eat green leafy vegetables, red meat and pulses. They don't understand. I'm given a high carbohydrate diet of mostly rice and pasta. I'd like to see them try to cook without a kitchen, with no money. I miss my family. I miss the connection, and I miss the food. How can there be so many people around you, and yet I feel alone? My baby has been punching and kicking for a while. At 34 weeks, I finally get my HC2 certificate. But I feel anxious about going to the pharmacy again. My friend comes with me to the pharmacy. No one knows my iron level is 6.2, but I can finally start taking iron tablets. It's only 4 weeks or so until I meet my baby. My tummy is getting bigger by the day. My ankles are swollen and walking is getting harder. This time I see another midwife. She's busy and she doesn't realize that my anemia needs to be checked. While I am in the hotel room, my waters break. I am 38 weeks and the contractions start. I am going into labor. At 3:07 a.m., I give birth to a healthy baby boy. Holding him in my arms, the little face of my beautiful baby, his softness, his warmth. He is my hope. My head is dizzy, struggling to cope with blood loss. Everything is fading. I think of him growing up with a home where he is safe, cared for and loved so much. I don't want to leave my son. Tell him how much I love him. When he needs me, tell him to look to the heavens. I'm Sama. My name means sky.
If I know how hell is, that's how I would describe the asylum journey. Comfort is my daughter I lost. It was a struggle, but I was very happy with the pregnancy. Is my baby going to be okay when I give birth? And they said, with the weight of a baby, they can do the operation on her. My baby will be fine. And they asked me if I want to continue the journey. It's my baby. And what they tell me, I have a hope in there. I want to continue with the journey. At that time, I don't have anybody around me. Just me alone with my pregnancy, with my baby. I give birth to my beautiful princess. That's where my challenge starts again. We don't have the weight they are looking for. I stayed with her in the hospital. Whatever she's going through, I'm here with her. I just want her to know that mommy is here for her. So I want to be with my child. They look after her in there, and they just give her 6 days. Please give her more time to fight for her life. But they refuse. Telling me they will take the machine off her. I just give birth to her. She's there alive. She's not dead. Give her more time. They don't give her more time to fight for her life. We need the resources, we need the equipment because for another baby. That was a really pain for me. You need to shut down my child life for another. They take their decision. I carry her for 9 months. I struggle with her. I have no one. I was an asylum seeker. I have no one. There is nothing left for me. That's the time I decide to end my life. Because I was thinking nothing good will come out of me. So what's the need of living? I just went into my hostel where they kept me as an asylum seeker. Take the knife, want to slit my hand. Then I just had a knock on my door. When I opened it, the police was there. They have to ask me, did you have anybody to talk to? Do you have anywhere to go? I said, yes, just take me to my support worker. Then when I went there, that's where I have a little bit of peace. She understands me what I'm saying. Someone to talk to cry to fight with. If I want to fight, if I want to shout, they give me the time to shout. And when I have another baby, for me to go to the hospital again, it was very hard. If I know how hell is, that's how I would describe the asylum journey.
You know, there's a say in my language that says, "Orike warundumbi," but even a lion needs the lioness. Even the lion, even the strongest person, needs company.
You know, kindness, no matter how little it is, it goes a long way.
A simple hug, a smile can go a long way.
We need people that are really patient with us. We need people that are kind and accommodative, understanding, because something good can come out of it, actually.
I have a lot that give me hope. The lovely people I meet during my journey, it was a hope for me. Because when I started it, I was thinking who to talk to, where to go, where to access. But on the way, I met them. They give me hope. And my daughter I have, that one is a great hope for me. When I give birth to her, I look at her and I said, I have someone to talk to now.
Change is needed.
To understand the challenges and barriers we face,
Let's improve nutrition.
Let's improve communication to help us navigate the health system.
Let's have more time for appointments.
let's have continuity of care.
So we can build trust and not have to retell our trauma. Together, let's reduce poor health,
including mother and baby deaths in the asylum system. Most of all, let's be kind.
When you know, you know.
When you know, what will you do?
When you know, you have a choice.
When you know, you can make change.
Oh, I'm finished. Yay!